This vaccine is used to help prevent certain serious bacterial infections, such as meningitis and meningococcemia, which can sometimes be fatal. These infections can cause severe problems such as hearing loss, brain/nerve problems, paralysis, blindness, seizures, and loss of limbs, even with antibiotic treatment. The vaccine works by boosting the body's natural defense, immunity, against the bacteria that cause meningococcal disease. Vaccination is the best way to prevent infection. However, like any vaccine, it may not fully protect everyone who receives it. The specific brand and dose of vaccine you receive will depend on your age. It's also possible that other vaccines may be given at the same time, usually in a different site on the body. It's important to follow your healthcare provider's recommendations for the best timing and dosage of this vaccine. Before receiving the Penbraya Menb component, PF, 120 mcg/0.5 ml intramuscular syringe meningococcal vaccines, serogroup B, it's important to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. This vaccine is administered through injection into a muscle by a healthcare professional. Typically, adults and children receive the injection in the upper arm, while infants receive it in the upper thigh. Depending on your age, you may need to receive the vaccine one or more times. It's best to consult with your healthcare professional to determine your recommended vaccine schedule. It's common for fever to occur after vaccination, especially in infants and children. In such cases, your healthcare professional may recommend a fever or pain relief medication, such as acetaminophen. If needed, be sure to ask your healthcare professional for more details on how to use the medication. As always, consult with your healthcare professional for the best timing and dosage of the Penbraya Menb component, PF, 120 mcg/0.5 ml intramuscular syringe meningococcal vaccines, serogroup B. Some common side effects of Penbraya Menb component, PF, 120 mcg/0.5 ml intramuscular syringe meningococcal vaccines, serogroup B may include pain, redness, or swelling at the injection site, headache, fever, chills, drowsiness, tiredness, joint or muscle pain, nausea, loss of appetite, or diarrhea. If any of these effects persist or worsen, it's important to contact your healthcare professional. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears after receiving the vaccine. If you have any of these symptoms, it's important to inform your healthcare professional immediately. Sitting or lying down may help alleviate these symptoms. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Most people who use this medication do not experience serious side effects. However, it's important to notify your healthcare professional right away if you experience any serious side effects, such as numbness, tingling, or muscle weakness. A very serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your healthcare professional. If you have any concerns about the side effects of this medication, it's best to seek medical advice from your healthcare professional. Before getting the Penbraya Menb component, PF, 120 mcg/0.5 ml intramuscular syringe meningococcal vaccines, serogroup B, make sure to inform your healthcare provider if you have any allergies or if you have a history of certain medical conditions such as Guillain-Barré syndrome, immune system disorders, or current fever/illness. This vaccine may cause drowsiness, so it's important to avoid alcohol, marijuana, and activities that require alertness until you can do them safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, discuss with your healthcare provider about the risks and benefits of using this vaccine. It is unclear whether this vaccine passes into breast milk, so consult your healthcare provider before breastfeeding. It's important to be aware of potential drug interactions that may affect how this vaccine works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your healthcare professional, including prescription/non-prescription drugs and herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Be sure to discuss any concerns with your healthcare professional before taking this vaccine. This vaccine is used to help prevent meningococcal disease caused by serogroup B bacteria. Meningococcal disease can cause serious and sometimes fatal infections of the brain, spinal cord, or bloodstream. This vaccine works by exposing you to a small amount of the bacteria or a protein from the bacteria, which causes your body to develop immunity to the disease. This vaccine will not treat an active infection that has already developed in the body. It's important to keep track of your vaccine records for yourself and your children. This will help prevent unnecessary revaccinations in the future. Once your children are adults, provide them with a record to share with their healthcare professionals. This will help them avoid unnecessary revaccinations as well. It's crucial to make sure that you or your child receives each vaccination on time. Make sure to ask your healthcare provider about the schedule for each dose, and consider marking it on a calendar to help you keep track. It's important to store this medication in the refrigerator, but make sure not to freeze it. Different brands of this medication may have different storage needs, so it's best to check the product package for instructions on how to store your specific brand, or ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.